Good evening. My name is Franklin Elia, one of the two co-founders of the Northern California Spinal Cord Injury Foundation. Welcome to tonight's presentation, Nutrition and SCI, an Introduction to a Healthy Diet in Spinal Cord Injury. Our presentation is part of NorCal SCI's Virtual is a New Reality series and is funded by the Reeve Foundation. Tonight's presentation is going to be about 45 minutes long and will be followed by a 15-minute Q&A session. You may submit your questions by either using the chat feature on your screen, or you may email them to info@norcalsci.org. We are also recording tonight's presentation, and it will be made available to everyone who has registered for it within 2 business days. So let's get right to it and introduce you to our speaker, Shelley Wood. Shelley received her BS degree in Nutrition and Dietetics in 2012 from San Jose State University. She completed her clinical internship at Santa Clara Valley Medical Center, one of the top SCI rehab facilities in all of the US. In 2016, Shelley completed her master's degree in public health. She completed her thesis in diet education for chronic disease prevention in the setting of spinal cord injury. She's been working at Santa Clara Valley Medical Center since 2013 at the acute SCI rehab and outpatient clinic, seeing hundreds of patients with spinal cord injuries every year. Shelley is the chair of the Dietitians in Medical Nutrition Therapy for Academy of Nutrition and Dietetics. She's a frequent guest lecturer at San Jose State University, and she's also a member of NorCal SCI's advisory board. So without further ado, I'm excited to present to you Shelley Wood.
Hey, Franklin. First of all, I want to say I'm completely honored to be working with this population. It's been about 7 years, and it's been the best career I could ever have imagined. I'm a late bloomer, obviously, so got into nutrition just you know, it feels like yesterday, and found my niche, and I feel like I have a lot of work to do here. And it's my mission, so I'm excited. And as far as drooling over food, I'm not going to share everything right off the bat. I'm going to make you wait and come to each of the sessions. So I consider this this session tonight to be kind of a foundational session. If you have not heard me talk before, it's all new information. If you've heard me talk before, it's going to be a bit of a refresher course, and I think it's important to hear more than one time. So this will set you up for future sessions where I'm going to break everything down into little bite-sized pieces, and I'm hoping that you get a lot from it. So here we go. Tonight, we're going to talk about an overview of chronic disease and risk associated with spinal cord injury, and then we'll dig more into actual risk factors with spinal cord injuries. We'll dig into a little bit of metabolic changes right after injury and then later on. I'm going to go through some fad diets a little bit more into detail this time, throwing in some current research because I try to keep up with everything that's out and stay as up to date as possible, because that is what I need to be doing for you and for myself. And then we're going to do a little housekeeping and talk about calories, because that is kind of the overview of what we're going to be working on throughout this whole series is caloric density. So we're going to go through caloric density and what it is. Then we're going to start talking about what a healthy diet looks like. This is just the Cliff Notes version. I'm going to start breaking it down in the next few sessions and really dig into that. I'm going to brush a little bit over COVID-19. There's no major specifics, but what I know about what you need to be thinking about nutrition-wise and health-wise for that. So why would you worry about nutrition? There are many reasons to worry about nutrition. Nutrition is oftentimes forgotten about, especially when you have medical issues going on. It tends to take a backseat, and it really needs to stay up toward the top of anything health related, because it plays such a huge role in health. Specifically, activity and inactivity play with nutrition hand in hand. So if you're not as active as you used to be, then you definitely need to be thinking about your nutrition intake. Short-term health, short-term as in days, weeks, months maybe. How you feel right now, and then long-term health. We're going to talk a little bit more about long-term health, skin integrity and wounds, Psychological well-being and overall happiness. I got into nutrition because I love to eat. I love food, and we all love food, and nutrition plays a huge role in that. A statistic from the Centers for Disease Control say that 43% of adults with depression were obese or more likely to be obese. So nutrition plays a huge role psychologically. Amputations, I've had a few patients with amputations, so that needs to be considered. And then we'll look more into transfers, weight shifts, and more SCI related stuff in a few more slides. So three key factors with why you would worry about nutrition. Two of them you really can't do anything about. So genetics, you inherit your health basically from your parents and from their parents and so forth. Can't do much about genetics. Environmental, so where you grew up, the neighborhood you were in, where you are now, your access to food, your environment. Those things oftentimes cannot be controlled. But they do play a role in your nutrition intake. And then lifestyle. So this is the part right here that you have control over. Smoking obviously is a key factor in your health. And so if you smoke, I really encourage you to quit smoking. But lifestyle, how you live your life, what you think about nutrition, how you eat, where you shop, how you prep your food. We're going to talk about all that. Lifestyle is where you have the most control in your health and your nutrition. So going into the chronic disease part, so diabetes is huge. It is defined as glucose or sugar, the main source of energy for our body cells. This is our source of energy. Level of glucose is controlled by a hormone, insulin, produced by your pancreas. So when this isn't working right, sugar builds up in your blood and it causes a lot of problems. This is very genetic. So if you have diabetes in your family, then you're more predisposed to have it yourself. Risks, well, first of all, 13 to 22% of those with spinal cord injury have diabetes. A lot of my patients have diabetes and they come to me with new injuries and have diabetes, or they discover they had diabetes and didn't know it. So it's very, very prevalent. And it's prevalent in our population here. So overall risk for uncontrolled sugar in your blood, so you can damage your blood vessels and your heart, nerve damage. This is where you can lose the feeling in your toes and have amputations and that kind of thing. Kidney damage from all that sugar floating around, kidney failure, eye damage and blindness, hearing impairment, skin conditions. Wounds don't heal when there's a lot of sugar in your blood and your body's not processing it properly. Wounds just don't heal. And then death. So diabetes is dangerous and it's very prevalent. Two things that you can remember about it. Being overweight is the #1 risk factor for developing diabetes. You may have genetics on both sides or whatever, but if you're overweight, you're way more at risk for developing diabetes. Usually most people that have diabetes have had at least one family member with the disease, and the risk goes up with the number of affected family members. So if it runs prevalent all over your family, then you need to be very careful. #2, and this is the one that's bolded here. So losing just 10% of your weight can dramatically drop your risk, as well as improve current symptoms if you have it already. So I know if you have been experiencing diabetes or have it and you've heard losing weight, yes, that is absolutely correct. Losing just 10% of your weight. So if you're 200 pounds, lose 20 pounds and that'll make a huge difference. And then the other major one is cardiovascular disease, these two. So cardiovascular disease is a condition that involves narrowed or blocked blood vessels. And the risks, and they're much, much greater with spinal cord injury. My thesis was on cardiovascular disease and spinal cord injury, and this is the #1 cause of death with spinal cord injury. So heart failure is a huge risk in able-bodied population, but it's 4 times greater with spinal cord injury. Heart attack, stroke is almost 6 times greater with spinal cord injury. Aneurysm, peripheral artery disease, sudden cardiac arrest, and death. Diabetes and heart disease, they go hand in hand. They're best friends. So if you have diabetes and no heart disease, chances are really good that that's coming because they come hand in hand. They're partners in crime. And so if you have one, you could get the other. So we need to be careful because obesity worsens the progression of disease. Unfortunately, the higher risk in male versus female. Males have more risk than females. So just keep these things in mind, and this is the crux of my work with nutrition here. So specifically for spinal cord injury, the prevalence of obesity is 40 to 66%. That's a national figure. 40 to 66% of those with spinal cord injury are obese. I see this in inpatient, I see this in outpatient, and this is where my work is right here, is working on healthy weight and healthy nutritional habits with the population. Overall, sarcopenia, loss of muscle, decreased metabolic rate, all of these things, limited mobility, lower activity, and then the risks are chest pain from inadequate blood supply to the heart, stroke, heart disease, kidney stones, colon cancer, depression, glucose intolerance, which leads to diabetes, reproductive dysfunction, and social isolation. Many risks. And then additional risk factors, so the risk of injuring yourself, risk of long-term shoulder health from propelling, transferring when you're overweight, losing independence if your caregiver can't help you, if your weight exceeds their capacity, increased reliance on other people, which decreases your independence overall, decreased independence with bowel and bladder programs when you're overweight, being able to reach for your bowel program. Decreased independence with ADLs, like getting dressed and bathing, the health of your caregiver, inability to access certain parts of your home because you can't go. Maybe your wheelchair is too wide and you can't get through doors to get to a bathroom or something like that. And then emergencies, able to get out of your house. If you're really overweight and it's hard for you to get around and your caregiver can't help you, then that's really dangerous. Further risk for spinal cord injury, custom equipment. Insurance covers custom wheelchairs every 5 years. I have had patients come to inpatient, have their custom wheelchairs put together with occupational therapy, and I see them a year or so later in the outpatient clinic and they've outgrown their wheelchair. So that is really serious. Most DME have weight capacities of 350 pounds, so like bedside commodes and wheelchairs. And then skin, pressure ulcers are more prevalent the more overweight you are. Risk for shearing and rubbing on the wheels of your wheelchair, posterior or sacral wounds from lying down. So these are all definite risks with being overweight. So what happens with your metabolism? What is a metabolic rate? So this means how fast your body burns the foods you eat, how fast it uses those things up. All of the nutrients, how fast it processes it. So you have a lot more energy needs and protein requirements right after an injury. Your metabolism goes through the roof right after a spinal cord injury, and your needs are sky high. About 6 to 12 months after an injury, depending on severity of injury, the needs come down a little bit. And oftentimes your needs kind of level out below where you were before your injury. This is due to lower muscle mass, lower activity level, and this is where we see the weight gain happen, is beyond the acute phase of injury and beyond rehab. You start to see fast weight gain. Let's talk a little bit about fad diets here. A few of my nurses right now in rehab are on a keto diet. It drives me crazy. Keto is not going away, unfortunately, but it's used with success, great success, in epilepsy. When children have epilepsy, the keto diet is fantastic. Some of you might have seen some research recently pertaining to spinal cord injury in the keto diet. This is focused on that acute phase of injury, right after an injury happens, oftentimes in the ICU, probably on tube feeding, on a ventilator, like right after. And it looks at inflammation and looking at the inflammatory state when a patient is put on a keto diet. So this is brand new research, and it has to do with that phase of injury, like right after. There's nothing on keto for the long term with spinal cord injury. And the reason why I wouldn't recommend it is because of the amazing amount of research out there that says that those with spinal cord injuries are at risk for heart disease. It's the #1 cause of death. We'll get more into that, but in the long term, your risk for heart disease is much higher. So constipation, we'll be talking a lot about constipation and bowel, but the combination of lack of fiber from the keto diet and the high protein, generally a high protein diet, it uses up a lot of water in your body. It can cause a lot of dehydration, which can also exacerbate constipation. So this is really dangerous. And some of you have levels of injury that involve autonomic dysreflexia, already have dangerous blood pressure issues. So you don't want to combine a lack of fiber with a high protein diet like the keto diet, because it can be very dangerous. Another risk for the keto diet is you can have tachycardia, which is rapid heart rate, which is, again, very serious for those who have AD. And then if you still want to explore the keto diet, your risk is higher for heart disease. So I would recommend getting a fasting lipid panel every 4 to 6 months and just really, really watch. The fasting lipid panel is cholesterol, triglycerides, LDL, HDL, all of those. You need to keep a very close watch on that. There is one benefit though for a keto diet. There's always a rainbow, right? Cutting out processed and sugary foods is not allowed on a keto diet. So I can always find the rainbow in any storm, and that is the one in the keto diet. The paleo caveman diet, that's another one that's kind of going around. We have evolved metabolically, environmentally, socially, agriculturally. I read something, I think it was just a couple days ago, that there's one thing we know for a fact about the Paleolithic people, and that is that they were, what is the word I'm trying to use? They ate humans. So that is a fact. They were, anyways, like Jeffrey Dahmer. So that is the one actual fact we know about the Paleolithic people and their diet. The benefit for the paleo diet is very similar, I would say, to the keto diet, but you're not in ketosis. I think they eat a lot of wild game and some vegetables. They cut out potatoes and they cut out bell peppers and that kind of thing. They don't allow processed and sugary foods. So there's the rainbow right there. The carnivore diet is kind of a new diet. It is meat only meat. That's it, just meat. And yes, that is a one-way ticket to a bowel obstruction. And I have actually seen such ticket to a bowel obstruction in one of the units of my hospital, and it was horrifying. So no carnivore diet, please. Intermittent fasting, if you've heard of that, that is where you eat all of your food within a window of time. So say you eat all of your food between 2 and 6 p.m. and that's it. It's a way to restrict calories, basically. You're cutting all of your calories out except for this tiny little window. If you can do that and you like to do that, that's okay, as long as you're getting all your nutritional needs met within that 4-hour window, and that's really hard to do. And besides, who would want to go all day long without eating? I get cranky. I don't know about you guys, but intermittent fasting is just a way to cut calories, but it's not a fun way to do it, I wouldn't think. Cleanses and detoxes. So we have these fantastic organs in our body. One is the liver and the other is two kidneys. Hopefully you have two. These organs are beautifully designed to detox our body. So unless you have any liver or kidney disease, I would suggest skipping cleanses and detoxes. The only thing you're going to detox is your wallet for sure. Okay, so diets in general. I don't like the word diets. That's why I put diets in quotations there. I don't like that word. It has a lot of negative connotation with it, but I put it there anyway. So just think about sustainability. How long did the diet last that you were on last? What about the one before that? Are you still on it? Have you been on, able to sustain it? I underlined this. A healthy diet is the one that's going to give you all the nutrition you need in the safest manner possible that you can sustain for life, forever. Something that makes you feel good that you can keep doing for the rest of your life. There is no start-stop. Diets and yo-yo dieting specifically is not good for your body. So rapidly gaining and losing weight is taxing on your heart. It's not healthy for you. So my goal for you is to learn how to eat well, how to feel good eating, how to get to a healthy weight if you're not there already. That's my goal. Cutting out entire food groups will totally defeat the purpose of eating a nutritious diet. And there's no quick fix when it comes to nutrition. Google is really the enemy. Investment in time and proper nutrition will yield greater results than a supplement or fad diet will. It's worth the effort. So going on to Google and Googling weight loss diet or something like that will take you down a rabbit hole. And there really is no quick fix. You really have to put the time and the effort into eating well to really feel well and to treat yourself well and be healthy. So the definition of nutrition, this is the process of providing or obtaining the food necessary for health and growth. Pure and simple. Just that's it. That's the definition. Let's go into some research. So this is a recent review. It's the Nutritional Health Considerations for Persons with Spinal Cord Injury. It's a big review article that was in Topics in Spinal Cord Rehabilitation in the summer of 2017. And the key factors, the key points in this were obesity and insulin resistance greatly increase risk factors for cardiometabolic syndrome. I already mentioned that earlier, that obesity and insulin resistance affects your heart. And so this says it. No evidence-based nutritional guidelines to address this risk. As of yet, I'm watching. Believe me, I'll let you know as soon as I see some evidence-based nutritional guidelines for spinal cord injury. Lifestyle modification, again, the third one, lifestyle, changes in diet, widely accepted for the treatment and prevention of cardiovascular disease. Energy imbalance, or basically eating too many calories, is a central factor in being overweight or obese. Measured resting metabolism, or metabolic rate that we talked about, is 14 to 27% lower than in able-bodied individuals. Most studies report that people with spinal cord injury consume higher levels of fat than the recommended intake. And then they also looked at reducing or eliminating energy-dense foods like saturated fats, simple sugars, refined grains, alcohol, those things. So basically what I'm going to talk to you about throughout these sessions. Lots and lots and lots of research in the able-bodied population, lots. And so this is kind of where we get our information from. And if you don't know me yet, you're about to find out that I'm a huge advocate of a plant-based diet. Don't run away, don't go anywhere. Trust me on this, okay? And I don't mean 100% plant-based, but all of the research out there on plant-based diets shows favorable health benefits. And these are things that will help you as well. So quick key points on additional research. These are all recent studies, and at the very end of my presentation, I list all the references so you can take a look for yourself. Beta cell function, cells that make insulin, significantly improved on a low-fat plant-based diet in overweight adults. Another review, meta-analysis looking at a ton of studies, almost 8,400 studies, concluded that plant-based diets are associated with improvements in lipid profile, again with the heart, right, compared with omnivorous diets, diets that include a lot of meat. There was an editorial that concluded that vegetarian diets represent an effective means for prevention and treatment of cardiometabolic diseases, again, heart protective. Another study, prescription of vegetarian diets reduced mean body weight, suggested potential value for prevention and management of weight-related conditions. Even more, and there's lots. I just picked the best ones I could find that were most recent. Another review, observational, looking at people over a period of time, and interventional studies, looking at control versus intervention, where they actually made something happen, found that plant-based diets resulted in a lower BMI and were effective for weight loss, chronic disease prevention and treatment. Another study, high adherence to healthy plant-based diets and vegetarian diets associated with favorable kidney disease outcomes. And then this bottom one, looking at the MyPlate recommendations, the government recommendations compared to a plant-based diet, and found that the plant-based diet was more favorable than the government MyPlate recommendations. So read up on those studies, learn. It's important for everyone to be aware of what's going on. Calories. What's a calorie? I won't bore you with the actual scientific definition, but go ahead and read it when you want to blow your mind. Basically, calories provide energy in the form of heat so our bodies can function. That's pretty much it. Our bodies store and burn calories as fuel. There's macronutrients, which are protein, carbs, and fat, and the micronutrients, vitamins and minerals. Micronutrients don't have any calories to them. So protein. We're going to talk a lot about protein. We're going to talk about all of these things. Protein, so beans and tofu, tempeh, all the plant-based proteins, eggs, chicken, fish, pork, beef, fish, all of those things. 4 calories per gram. That's what protein provides, is 4 calories per gram of weight. Carbohydrates provide the same. We know what carbohydrates are, whole grains, hopefully, fruits and vegetables, things like that with fiber. And then fat, yes, fat is bolded, 9 calories per gram. So notice the 4 calories per gram for protein and carb, and it's more than double for fat, 9 calories per gram. And I don't have alcohol on here. Alcohol is 7 calories per gram, and alcohol will definitely hinder any kind of weight loss endeavor you have. So if you're drinking alcohol, you probably want to put the kibosh on alcohol because it has a lot of calories. So we're focused on fat here. Fat has a lot of calories per gram. A disclaimer. So a plant-based diet. If you have a kidney disorder, chronic kidney disease, anything like that, plant-based diets have tons of nutrients, including potassium and phosphorus. When you have kidney disease or any kind of compromised kidney function, these minerals, potassium and phosphorus, can build up in your blood, and you're going to need to talk to your nephrologist about this and work with a dietitian if you have a kidney disorder. They can work around it. Cardiovascular disease, so blood thinners. Some of you are on blood thinners, and eating more plants might include a little bit more vitamin K, which is the clotting vitamin. So they tell you now that you want to dose the blood thinner to your vitamin K intake. So you're going to need to work with your doctor as you increase your vitamin K intake in the plant-based diet. Blood pressure medication, just so you know, potassium, plant-based diet is higher in potassium. Potassium is a mineral and an electrolyte, and it plays a role in regulating your heartbeat and your breathing. So you want to talk to your doctor about that. Side note, most people don't get enough potassium in their diet. Potassium's my challenge. I have a hard time getting potassium in my diet for some reason. Diabetes, so plant-based diet is higher in carbohydrates, but on the flip side, it's also a lot higher in fiber too. Fiber helps slow down the uptake of sugar into your blood, which can kind of regulate your blood sugar better. So having a high fiber diet, even if you have a lot of carbohydrates, can actually help you with your diabetes. If you have diabetes, check your blood sugar, keep a log, watch for trends as you start to implement more and more plant-based foods. Work with a dietitian to balance out your carb intake throughout the day. Usually you will see an improvement in blood sugar control. I've seen this in my patients. Everyone, just for fun, maybe tell your doctor, your primary care doctor, you're going to start implementing more of a plant-based diet and have them do a fasting lipid panel on you so you can get a baseline and you can see some improvements because they're there for you to see. I've seen it myself in the outpatient. I've seen my own fasting lipid labs improve substantially, and I won the lottery with diabetes and heart disease on both sides of my family. So it runs in my family, and I saw a big improvement with my transition to plant-based. The more you study this stuff, the more you know you need to do it, right? I feel fantastic. Okay, caloric density. So what makes a food filling and satisfying? Something that has bulk, high in water, high in fiber, high in nutrients. Our stomachs hold about 4 cups stretched, right? So 4 cups is like the size of your fist, 4 of them. Your stomach can stretch out pretty good. So what does 500 calories look like in your stomach? Take a look at this graphic. Oil on the left, working its way up through, like you only get this much oil for 500 calories, a little bit more for cheese, some meat, beans and grains, and like your stomach is going to be full with fruits and vegetables for 500 calories. This graphic you're going to see over and over and over, and I'm going to be bringing it back. It's never going to go away. So I just want you to get familiar with this, okay? So on the bottom, I hope you can see it, and I apologize if you can't see it. You will have the availability to take a look, and you can zoom in on this stuff. But on the bottom, on the left, you see vegetables and then fruits. Unprocessed complex carbs, those are whole grains, fruits, and veggies for 500. Sounds like Jeopardy now. Legumes for 600. Legumes, beans, animal products, and then you have processed. CC is processed foods like corn flakes. Let me go back. Unprocessed is foods in the most natural state, like corn. Processed is like corn flakes. That's what processed CC means. And you see all the arrows and everything. This is basically how many calories per pound these foods have. So vegetables are like 100 calories per pound. That's a lot of vegetables, honestly. And then 400 calories per pound for oil and fat. So just kind of get familiar with this graphic, because we're going to be playing around with this for future sessions. What's caloric density? How many calories in a given weight of food, basically. If there's math lovers out there, and I know there are, I'm a huge math lover, didn't used to be, but I play with it all day now. For math lovers, what you do is you take the calories in a serving of a food and you divide it by the weight of that food in grams or ounces. So broccoli's 35 calories, and I don't have the serving size here, but 35 calories for 100 grams. I don't know what that equates to. I'm thinking it might be a cup or something like that. So the caloric density is 0.35. White bread, 266 calories for 100 grams also, but the caloric density is 2.66. So the lower you go in caloric density, the better. So foods that are high in water, fiber, and nutrients are going to be lower in calories and be on the left side of that graph and have a lower caloric density. Foods that are low in water, fiber, and nutrients are higher in calories on the right side and have higher caloric density. So like I said, we're going to come back. So the foods on the left are low in caloric density, low in calories, and the foods on the right are way higher. So eating more food from the left side of the chart, the green side, and less food from the right side, that's where you get your weight loss. Eating less food from the left and more food on the right is going to result in weight gain. So going back to the graph, you eat a lot of nuts and seeds and oil and fat and junk food and less vegetables, fruits, and unprocessed complex carbs, you're going to see some serious weight gain. A lot of comfort foods that we call comfort foods. My comfort foods now are like stone fruit in the summer, but like comfort foods like Krispy Kreme donuts, like that stuff lives on the right side of this graph. The more of that you have, the more risk for weight gain or further weight gain you're going to have. Eating more foods on the left is also really beneficial for high water and fiber content. So we're going to be going back to, the bowel program and having healthy bowel movements, and having fiber and high water content's really essential for regular bowel movements, successful BTP programs. We'll be talking about that throughout all the sessions. Foods on the left also have way more vitamins, minerals, and antioxidants, and they're anti-inflammatory. They're healthy. They will keep you healthy and give your body what it needs to run well. For those who are underweight, and I have patients, quite a few patients who are underweight, so you can still get the benefits from the food on the left, and I encourage you to eat foods on the left, but you also need to add in more of the healthy fat. Foods on the right, like avocados and olives and nuts and nut butters and seeds, a lot of those things are portable, so I will probably have to dig a lot into fat in the future session, and so I'll be talking to you for those of you who need to gain weight. So that's the trick right there. They're high in calories for a very small amount and can help you increase your overall calories for weight gain. Just keep in mind, being underweight carries a higher risk for infection and wounds. And make sure that you're being followed by a dietitian, especially if weight gain isn't happening or if you've got wounds, because that takes a special plan. And so reach out to a dietitian. So here's the graph. When it comes to underweight, focus, don't forget the fruits, veggies, you need those things, but focus more on the nuts and seeds and oils and fat, avocado, olives, that kind of thing on the right side. So what does a healthy diet look like? I love this acronym. There's a credit for it in the references. CRAP, calorie rich and processed foods. Just cut the crap, put your health first. You're going to want more plants, vegetables, fruits, beans, legumes, whole grains, less fat. So fat makes it difficult to regulate your bowels too, because our bodies process fat slower. So if you're having problems with your bowel program, then you probably also want to reduce your fat intake as well. You do need a little fat with your diet. It's important that you have some fat, especially if you're eating a lot of fruits and vegetables. Have a big salad. You want to have 1 to 3 ounces of nuts and seeds and avocado with it. A little bit of olive oil, just because it helps you absorb certain nutrients in those vegetables, which we will talk more about. So definitely want to include a little bit, but you certainly don't, if you're trying to lose weight, you don't want to have too much. You want a rainbow, so we're going to be talking about all the different colors. Different colors in produce have different nutrient compositions, vitamins, minerals, and antioxidants. You want to go for as many colors as you possibly can each week. Have fun with it, try new foods, try different variety, explore the produce section, go to the farmer's market when it's safe. You want to explore, talk to farmers one day when it's safe, find out about their produce. If you see something strange in the produce section, maybe ask what it is. How do you prepare it? Try it out, see if you like it. If you don't like it, then try it again a different way. Have fun with it. Try new grains and beans. Look for plant-based recipes, and we're going to be talking a lot about different ways to implement a plant-based diet. Okay, there's room for other foods. So plant-based is different than vegan. Vegan has kind of a bad reputation, that word. Like, people think vegan, oh my gosh. But a plant-based diet means it's based on plants. Doesn't mean 100%. Some people are 100% plant-based, but make room for some of the foods that you're used to enjoying and in certain occasions and things like that. But like, maybe aim for 90% plant-based. We're going to talk a lot more about implementing more and more plants into your diet. There is no perfection with a plant-based diet. I have chickens. My chickens lay eggs. I eat their eggs. Who wouldn't? Every once in a while, I'm plant-based too, because like I said, I've studied plant-based diets for a while now, and I can't go and eat hamburgers knowing what I know. So it changed my outlook big time. It should be fun. Nutrition's really fun. It's not what you eat though in one meal. So if you go to your grandma's house or you go to your aunt's house and you have like something traditional, enjoy it. Have fun with your family when it's safe. But just enjoy nutrition. It should be fun. It's not like one meal that you eat. It's the overall picture of your diet quality over time that has the most impact. If you're overweight, it didn't happen overnight, and certainly weight loss doesn't happen overnight either. But my mission is to make it fun. I'm going to teach you everything that I can about implementing a plant-based diet and make it fun. And you're going to start to feel better and lose weight. And that's my goal. So COVID-19, there's nothing specifically for spinal cord injury, although some infectious disease and chronic illness is definitely, you're more at risk for those, especially if you have respiratory issues too. But we follow the leading organizations right now, the World Health Organization, CDC, the Academy of Nutrition and Dietetics. I've looked into all of these, and all of them agree that proper nutrition is vital. People that have a well-balanced diet are healthier overall and have stronger immune systems, and lower risk for chronic disease and infectious disease. So we've been talking about this, and we're going to keep talking about how beneficial it is to have a well-balanced diet. Stay hydrated. Avoid eating out, so you can stay away from people. It reduces your rate of contact, so try to avoid eating out if possible. Be careful with your food. Handle your food properly so you don't get foodborne illness or food sickness, which can weaken your immune system. Keep your hands clean, obviously. Practice hand hygiene. And then if you need to, seek counseling and get psychosocial support if you need it. So I tend to talk a little fast. So what I want to do in the next session that we have together is I want to focus purely on protein. We're going to talk about all the different kinds of protein. We're going to talk about myths about protein, how much you might need, healthy sources, how our body handles protein, why protein's important, in which circumstances you would want more protein and how to get it. And we'll go over all the different nutrients that way until we've gone through pretty much as I could possibly stuff into your brains about the plant-based diet and how to get to a healthy weight and stay at a healthy weight and hopefully improve your bowel program. And that's my goal for this whole series. So stay tuned for future sessions, and I will start working on protein. I'll see you at the next one. Any questions?
Okay, thank you, Shelley. There are a few questions, but before I start them, let me kind of share something with the group. So I've been working with Shelley on this along with another colleague of ours who's actually joined this session tonight. His name is Arash Bayatmaku. In the interest of full transparency, Arash is a member of our board of directors. He's also a cervical injury level survivor. And so what we have done is we have worked together to basically establish companion sessions where, as Shelley is going to be discussing sort of the nuts and bolts of the various sessions that she's going to be taking on over the next several months. I'm pleased to say that Arash, who has an incredible passion for food, and he has adopted many of the sort of teachings and everything that you're going to be hearing Shelley talk about into his day-to-day sort of diet. We're going to be having these sort of cooking with Arash sessions where he's going to demonstrate how he's able to adopt many of the things that Shelley is going to be taking you through, and sort of making some, yummy food. So, Arash, you're on the call. Can you hear me?
I can. Can you hear me?
Yes. Why don't you tell everyone real quick what they can expect from your sessions, which, by the way, the first one is going to be on Wednesday, August 27th or 26th. Let's see. 26th. So go ahead, Arash.
Yeah, thank you, Franklin, and many thanks to Shelley. I'm really excited to be part of this collaborative effort. What you can expect from me in these sessions is, like Franklin said, I'm going to be trying to do more of the practical and the kitchen side. Much of what, to support much of what Shelley has been talking about and will share. So for me, I've cooked my entire life. Well before I was injured and using a wheelchair, but it's one of the first things that I wanted to do after my injury, and I was fortunate enough to be able to start doing that. And so I've developed what I think is a good amount of information and experience. Excited to share all of that with you, field questions, take requests, whatever it is that's most helpful for everyone, because I'm so passionate about this subject, and I know that we all can do more to improve our health, to cook, to be more involved in the kitchen. So that's what you can expect from me, and thank you both again for including me.
Great.
I'm so excited to work with you, Arash. This is going to be fun.
Yeah, and this will be right from his kitchen too, but don't expect, one of those cooking shows. He really wants to show you a lot of the things that he's adopted, a lot of the sort of tips and tricks in terms of food prep, the tools in the kitchen, how to shop, and how to make sort of food that would last you, over the long haul, that you don't feel like you need to be cooking, 3 times a day. So we're looking forward to his contribution starting in August. So thanks, Arash, for hopping on the call. Okay, now on to some questions. So Shelley, first question is, I love fruit, especially in the summer, and I know it has a lot of sugar, natural sugar, but I recently heard that more than 1 serving is not recommended for those with SCI. What are your thoughts?
Well, first of all, I haven't seen that research. Sugar in fruit is also attached to fiber, and that doesn't make it like table sugar, so you have your sugar, and then you have your fruit sugar. And fruit sugar has fiber, and that helps slow down the uptake of sugar into your bloodstream. And so, and the sheer nutrients in fruit, especially if you buy it seasonally, outweigh the benefit. And I find fruit to be actually quite helpful with my patients who have bowel issues. So until I see research saying otherwise, I will push fruit.
What would be an ideal serving per day?
I would say, I mean, depending on your size and your needs, a peach, a handful of grapes. Right now is stone fruit season, just a couple plums, several servings a day, probably at least.
Okay.
Yeah, you don't need to limit yourself to one piece of fruit. I think fruit is actually really important for a good bowel program.
Okay. I see a big grin on the face of the person that asked that question.
Fruit is okay. Eat it right now too. It's summer.
Great. Okay. Next question. A friend told me about superfood for older women. Do you think Sarah Vitals is okay? I don't know what she's referring to, but
sounds like a supplement. Again, with the detoxing your wallet. I'm not really a big fan of supplements. If you can get the right amount of nutrients from eating food, our bodies really prefer the actual natural source of food. Broken down food into supplements, not the same as just eating the food. That being said, if you're deficient in anything in particular, then you probably need a supplement. I know that, I don't know the statistic, but I'm willing to bet it's at least 75% of us are vitamin D deficient. And I don't even want to know after COVID how deficient we're going to be. So supplements, not a big fan. If you can get those nutrients from food and eating a well-balanced, healthy diet, you can't make up for that with supplements. You just try to eat a healthy diet and you'll get everything you need.
So expand on the comment that you just made about not knowing what it's going to be like after, with COVID. Are you referring to you were talking about vitamin D?
Vitamin D, people being in the house.
In the house. So the recommendation is what, to be 15 minutes outdoors every day?
Yeah.
Or
Yeah, but the thing is we're trained to wear hats and put sunscreen on, and so it's more like 10 or 15 minutes in the sun with as much skin showing as possible to get the right amount of vitamin D. But if you have skin cancer in your family, if it runs on either side or both sides like mine, then talk to your doctor. You should probably get your vitamin D level checked every 6 months or so. I would just get it checked.
Okay.
Yeah.
All right. Next question. What are your dietary recommendations for those of us who have recurring urinary tract infections due to having neurogenic or semi-neurogenic bladder issues? I'm trying to lose 6 pounds while staying gluten and dairy free, as well as avoiding foods that irritate my bladder.
Okay.
This is from someone who's a C4 and 5 from about 5 years ago.
Okay, so the biggest problem I have with my patients who have issues with bladder infections is dehydration. I don't know if you cath or if you have a suprapubic tube, but staying hydrated is, unfortunately, I ask my patients who have frequent urinary tract infections, how much water are you drinking? A bottle. How much is it? But like 16 ounces, that's it. So honestly, check your hydration first. That's my number one recommendation for you. Stay hydrated, drink as much water as you can. If you cath, make sure you're doing that safely, especially if you have AD. And then the other thing is cranberry juice and cranberry supplements. There's some research that says it helps bacteria not stick to your bladder, but there's nothing definitive about cranberry. So as far as diet, I haven't read any research on limiting dairy for that or anything like that. But I would say the number one issue I've seen is dehydration, and that most people don't drink enough water anyways. So start there.
Okay. I noticed that you did not refer to Mediterranean diet as a fad diet. Is that not the case?
No, the Mediterranean diet is not a fad diet. That actually is mostly plant-based. Take a look at it. With the exception of fish, a small amount of fish. So that actually fits into the 90%, right? So a Mediterranean diet is abundant in fruits and vegetables and all, so a little more fat in the Mediterranean diet than what I'm recommending. So olives and olive oil and nuts are very prevalent in the Mediterranean diet. So maybe won't be your first effort to try to lose weight with a Mediterranean diet, but if it works for you and you're at a healthy weight, it's tons of plants. So it's mostly plants on the Mediterranean diet. Just watch that fat that they recommend. It's a lot of fat.
Okay. Next question. I have an 8-year-old with a spinal cord injury, and I was wondering your thoughts on pre and probiotics use.
I don't have a problem with pre and probiotics. If your 8-year-old's on antibiotics, then I definitely agree. There are plant-based sources. We'll talk about those in future sessions. Fermented foods have prebiotics in them. Actually, vegetables are prebiotic. That's what your healthy bacteria eats in your gut is produce, plants and fruits and that kind of thing. The healthy bacteria thrive in there. So a plant-based diet is really beneficial for that.
Do you have any recommendations on which brands and type?
Well, there are, so I'm mostly plant-based. So there are plant-based yogurts out there now with cultures, live active cultures in there. I don't have any brands in particular. In fact, if you dig into plant-based yogurt, it's more of a taste test and preference thing. You'll have to find one that tastes good to you. If you do Greek yogurt has lots of live active cultures. Basically, if you're doing something like yogurt, then you want to probably look and see how many cultures are on the label and go for as many as possible. The more the better, because there is no one culture that our body needs. The hospital uses lactobacillus, and that's because it's the most widely studied one in acute care. But that's only one, and so the chance of missing the mark is pretty high for that one. So I hope I answered your question there.
Okay. Do you think using Peristine for bowel program affects your flora in a negative way?
Ooh, Peristine is fairly new. We don't use that in our hospital. I've heard of it. I don't know enough about it to answer that question. But I will make a mental note to learn a little bit more about Peristine.
Okay. Can you just give a quick outline of the next several sessions? What are you really going to try to focus on within each?
Breaking down different nutrients. So we're going to do protein next. I have to review what the next one is. I think it might be vegetables. I want to go over vegetables. Breaking down each of them into the nutrients that they provide, looking at color, how our body processes them, fiber. As I go into the vegetables and fruit section, we're going to talk more and more about fiber and bowel. Going to do something on fat in the future too, different kinds of fat, how our body processes that. That's pretty much that in a nutshell. I haven't written the next session, so I'm not in danger of sharing anything right now.
All right. Well, those are all the questions, and we are actually coming up to 7:30, so we do want to run along. Thank you so much, Shelley. All right, so a couple of quick notes here. Again, we recorded the session, so you'll have access to everything that Shelley shared with you in a couple of days. I'll send that out to each and every one of you with a link to the video. And then her next session is going to be hopefully sometime next month. We haven't quite figured out a date. If not next month, it'll be in September. But it'll be part of 6 sessions that Shelley is going to be leading for us over the next several months. And again, this is part of the grant program that allows us to bring you these types of sessions. So if you have any other sort of questions that didn't get answered today or something that came up, shoot us an email at info@nordcalsci.org. And then, like I said, look for an email with a link to the video. I want to thank you again, Shelley. Thanks, Arash, for jumping in as well. And thanks to everyone who participated. Have a good night and look forward to seeing you all at the next session.
Thanks, everyone.
Okay,
See you
thanks
soon.
again. Okay, bye, Shelley.
Bye.
Bye-bye, everyone.